All right, so the next time you hear or you think that a delay in care or a delay in the decision for medical diagnosis can't have deadly consequences, I want you to refer back to this episode. So again, I'm yours truly, Dr. Pierre, board certified internist, host of Medicine Mondays. And today we're going to be talking about several things, but it's going to be underlying vaginal bleeding. We're going to be talking about an unfortunate case of a very popular YouTuber, Jessica Pettway, who passed away from cervical cancer. We're going to be talking about how, as a patient, not only do you need to recognize the signs and symptoms that your body is saying, hey, something is different, something is wrong, but more importantly, being able to understand I need to kind of advocate for myself. And even if the healthcare provider isn't recognizing the signs and symptoms, because sometimes, and I take it all the time, as a healthcare provider, we are not perfect. We are not robots, right? We will miss things, but because we will miss things, it not only takes us having to make sure we are going the extra mile to making sure we don't miss those things, even though it's guaranteed you're going to miss something. But if you take the extra mile to make sure you don't miss something, you're going to catch a lot of things. But even as a patient, understanding, hey, you know what? I know my doctor isn't perfect. I know my doctor may miss things. I need to make sure, hey, I think something is going on and we need to make sure we attack it together. And I'm going to talk about vaginal bleeding. You know, as an internist, vaginal bleeding ain't one of the topics I really enjoy talking about, but it is one of those topics that once you recognize, hey, something may be going on, something needs to be done about it. And I hate that it takes a story like this to kind of highlight several different aspects of our healthcare when it comes to delaying diagnosis, delaying care, when it comes to kind of the discrimination against women, especially Black women, when it comes to their healthcare needs. And more importantly, which again, as a healthcare provider, I take on the chin, making sure that we are doing all the steps that need to be done so that our patients, when they do try to empower themselves for better health, don't feel like they're left out on an island stranded. So let's talk about vaginal bleeding just for a little bit. The introduction that I typically have, especially as an internist, y'all know as an internist, you know, we don't get as much women's health, but the women's health we get is typically in the acute pathology stage. When I was doing outpatient medicine, it was one of those chief complaints. When I would see it down, I'm like, all right, I already know what I need to do. I already know who I might need to send you to. Because when you have vaginal bleeding, something that occurs regularly for women, and they figure out, one day they say, hey, you know what? The thing that's been occurring probably all of my life, I think something is different about it. The alarm should already be ringing. If something that typically occurs, and again, I know because I don't want people in the comments to say, oh, mine's is every 5 weeks or 6 weeks, but I'm just going to say monthly. Please just stick with me for a second. For those that typically occur monthly, an occurrence that typically occurs monthly with menstruation, for your patient to say, hey, you know what? Something is different about this bleeding. You need to make sure that everything gets ruled out. And as an internist, especially one who takes care of patients in a hospital, I'm always big on making sure that I rule out the things that may kill you. And in terms of vaginal bleeding, and we'll talk about it later, we'll talk about the stuff that can kill you. When we talk about Ms. Pettway, who unfortunately had to go through the stages of recognizing something is wrong, something that normally occurs is definitely wrong with me, and seeking advice. And I'll talk about where I think there are decisions that could have been made differently on both sides, because I think that's important. As a healthcare provider, I'm going to champion ourselves and understand that we're not superhuman, right? We're not robots, we're not computers, we're not machines. And yes, we can miss things. And that's why as a patient, there's decisions that the patient needs to make sure that you give all the evidence and you give all of, whatever that healthcare provider needs to make the right decision for you, right? Because as doctors, it's tough, because when you do make, I don't want to say mistake, but when you do make a decision where a delay in care occurs, right, you start Monday morning quarterbacking more than anybody else. I'm going to show a series of posts of hers that I think highlights a lot of different aspects of medical care and delay in care and misdiagnosis that I think will be very valuable, not only for you, and especially if you're my men watching this or listening to this on a podcast, or you're the women in your life. In fact, I want you to go ahead and send this episode to them as well. So let's take a look. So Jessica Pettway passing after being misdiagnosed is shedding a light on disparities in healthcare for Black women. So y'all know one thing I like to talk about unfortunately, because it's so prevalent, is this aspect of healthcare disparities, especially amongst Black people. And when we talk about Black people, and then we break it down to Black women, it's even worse. I love giving is the fact that you can have someone as famous as Serena Williams recognizing, hey, something is going on, something is wrong with me, but because of medical bias, implicit bias, whatever the thing is that's unfortunately ingrained and embedded within medical care in our healthcare system, diagnosis can be delayed and can have deadly effects. Fortunately for Serena, she was able to advocate for herself and was able to find out, like, hey, I have a pulmonary embolism. But not everyone is Serena Williams. Not everyone is this extremely popular YouTuber, right? Because for every popular YouTuber who has cervical cancer, there's going to be a lot of women out here who may have a diagnosis that gets missed because they don't have the outreach, they don't have the reach or popularity that when they tell their story, a lot of people will listen. So hopefully that will listen today. So beauty and fashion influencer Jessica Pettway has died according to posts from her family. After an appointment with an oncologist in 2023, she discovered she had stage 3 cervical cancer after being misdiagnosed with fibroids in 2022. So again, we have a combination of, is it a delay in care? Is it a misdiagnosis? I can tell you when I first read that and I say, I can almost assure you that the doctor did not confuse fibroids for cervical cancer, because those are two separate pathways, two separate diagnoses, which we will talk about. But I can see if the chief complaint is vaginal bleeding, how it may be put off and how it may be delayed if the right steps aren't taken in place. I've talked to some of my OB friends and they'll say, like, no, if I hear vaginal bleeding, I'm going to make sure it's not cancer. But again, I can't speak and we can't speak for every single physician that you come in contact with, right? This is why you watch a show like this, because you say, hey, you know what? I watched that Medicine Mondays episode, or I listened to that podcast episode with Dr. Barry, and he said, if I got vaginal bleeding and it seems abnormal, even abnormal to me, even if I think what is typically considered abnormal is normal for me, I need to do something else about it. So this is kind of where we're at, right? So let's take a look at some of her words. I took these photos a few days ago, and it's currently my favorite photo of myself. It brings me joy to see how far I've come, because a few months ago, I received devastating news. I was diagnosed with stage 3 cancer. I don't know where to begin, but I want to share why I've been gone for so long in hopes that at least one person is encouraged by my story. So here it goes. And I think this is important. Y'all know one of the biggest reasons why I started, getting on social media was not only to promote education, not only to promote healthcare, not only to help get you guys to think like a doctor, but I had my own father who passed away when I was in medical school. And mind you, he had a son who was in medical school and still didn't tell his son about the medical issues that he was dealing with. So think about that. You can have family members who are in healthcare and still not be told about all of their medical issues. I love that she is saying, hey, you know what? I'm hoping that at least one person can hear my story and make different decisions that I made. And hopefully that saves a life, because this is what it is, right? Yes, we're talking about a life and death. Yes, we're talking about cancer, but it starts out with a diagnosis that we might have brushed off. And a lot of people are brushing off diagnosis on a day-to-day basis thinking, oh, I'll get to it later. A lot of healthcare providers are brushing off diagnosis like, hey, I'll get to it later. For a lot of people, later does not come. Again, I love that she says, you know what? I want to make sure that at least one person can hear my story. When we're talking about the backs of healthcare disparities, when we're talking about the backs of a healthcare system that its foundation was based on the fact that, you know what, I'm going to exploit this certain race when it comes to diseases, when it comes to procedures, for the advancement of medical care. I'm going to exploit this race. You can have cause for concern why someone may delay care, may not tell their doctor everything, may not even go see a doctor for things. So let's take a look. Last June, I was having intense vaginal bleeding. And when I say intense, I mean literally bleeding out. Now, again, here she notes, hey, I was having problems. And this was like intense, like just to give an idea. So clearly this is not normal for her. Again, some people are walking around with signs and symptoms that are not normal for them and completely ignoring it. So when I say intense, I mean literally bleeding out. I called around and asked other women if they experienced this before, and majority of them said they have. I thought, well, maybe this is a normal thing that women go through. So again, this is one of those things where you have an issue happening to you, and she goes to seek the counsel of like friends and family members. She says, hey, I'm having this issue and it's different for me, but like, is this normal? And because she hears enough confirmation confirmation that, hey, this happens to me too, this happens to me too, she kind of puts it to the back burner, right? When we talk about delay of care, she puts it to the back burner. Why? Because she sought counsel who she thought was right counsel. Hey, I'm going to talk to other women who are dealing with vaginal bleeding because I think this may be something wrong, but she gets confirmation that, hey, it's not nothing wrong. Well, I deal with that too. So she said, I felt this was a normal thing to happen. I was experiencing extreme fatigue and weakness and just not feeling myself. But again, I accepted this as a normal symptom that most women go through. How many of us are having issues of concern that we think it's normal? And once we get the confirmation bias, we say, oh, okay, yep, this person said it's normal. That person said it's normal. It must be normal. And again, that's where the alarms for me is ringing. I said, oh man, imagine if last June she talked to one or two people who said, you know what, this is not normal. I don't think this is normal. I think you need to seek professional advice. But she didn't. Again, she thought this was normal. And when it comes to menstrual bleeding, uterine bleeding, vaginal bleeding, because it is so different for everyone, again, like I said, I know someone's going to be in my comments, oh no, again, I have it every 5 weeks, or mine's is heavy, mine's is light. I understand that. But here you have someone who says, you know what, it's different for me. This is different. This is intense. This is bleeding. I'm extreme fatigue and weakness. I'm not feeling myself. But because she had enough people say, hey, that's normal, she kind of brushed it to the side. We're going to talk about vaginal bleeding, signs and symptoms, because when I read extreme fatigue, weakness, especially with that much bleeding, she's likely anemic. And when you're anemic, you're going to be tired. You're going to be weak. You're not going to feel yourself. You're going to be sluggish. Some people get short of breath. There are some signs and symptoms that typically occur when you're severely anemic, because our bodies are great. Our bodies can deal with levels of anemia that it really should not be able to deal with, but it can until it cannot. I say this all the time when I'm talking about high blood pressure. Our bodies can deal with high blood pressure for a really, really long time until it can't. And once it can't, guess what happens? You have a stroke, you have a heart attack. So she was having profuse, intense bleeding, pain, and it got to the point where she became weak, fatigue. Me, I'm like, oh, I'm pretty sure if anybody does some blood work, she's likely anemic, because that's what I see right off the top here. So let's keep going. The bleeding eventually stopped, but was replaced with labor-like pains. Again, so now, again, changing condition. So she went from bleeding a lot to now she's having extreme amount labor-like pains. Again, I can't tell you what labor-like pains feel like, but when I talk to women who went through labor, they say it hurts. So she's having not her typical menstrual cycle where she's having some bleeding. No, she's having the bleeding, the weakness, the fatigue. So she's having a lot of symptoms here that's very concerning. My life became so limited. This is a big one for me. So what she used to be able to do on a day-to-day basis, she can't even do anymore because of her signs and symptoms becoming so severe. And again, this is where the ding, 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 ding. This is where I want the alarms to ring. This is where I want alarms to ring for anyone who is watching or listening to this. When you have something that is occurring to you that is different, that is now affecting the way you typically normally live your life, you need to be ringing some bells and seeking some professional help, even if you have a couple people tell you that it's normal. On December 31st, 2022, the bleeding came back. It would not stop. I was hospitalized again January 7th. So apparently she must have been hospitalized prior to, or maybe around January, and was there for a whole week. I was told I could not get surgery to remove this fibroid due to my lack of blood supply. And we kind of talked about her being, lack of blood supply is kind of insinuating that she was very anemic due to fibroid, due to my lack of blood supply. So she's probably already gotten a diagnosis sometime during this time where she has fibroids. And they say, hey, no, you're too anemic to even have surgery. And my hemoglobin level was a 4, ladies and gentlemen. Now, unfortunately, I've seen lower hemoglobin levels. Again, when I tell you the body works amazing, if my hemoglobin level drops to a 4 right now, like that, like I'm likely dying. I'm dead, right? Because normally I'm living in the 11 to 13 range. But if you have a slow decline, and which is, again, she's been dealing with this for months now, your body can kind of get adjusted to, all right, no longer 10, 9, 8, 7, 6, 5, 4. Like your body can kind of deal with that. And it just, again, she said it, my life has been very limited. I'm very weak. I'm tired. I'm always fatigued. Your hemoglobin is 4. That's likely going to happen. To the point where she had to received 10 blood transfusions during that state. And I can tell you, if her hemoglobin was 4, it was likely lower, because you get to a point where you're so what we call hemoconcentrated that the 4 is me rounding up. And once I give you some just regular fluids, that number is probably closer to like 3. Again, just from history, I'm guessing her number is closer to 3. At that time, they recommended that she do a biopsy of the mass. I'm concerned at this time, I'm assuming. Well, on July 1st, 2022 at 4 4 a.m. My husband found me in the bathroom, unresponsive, not breathing. I had literally passed away. He called on Jesus to bring me back, and I came back. I was rushed to the hospital where they told me that extreme blood loss was due to fibroids. Oh, okay. So this slide was just misplaced. So in July, that's when she must have been hospitalized, because that's when she was diagnosed with the fibroids. My gyno made it seem like it was so normal and common. So this is concerning, right? Of course, they highlighted it, right? Because again, they're trying to highlight the fact that they think maybe a doctor might have missed a diagnosis. Now, again, I can't speak for every gynecologist out here, but if you tell me you have intense bleeding, weakness, fatigue, your peace of mind and your daily activities of living have become limited because you're bleeding so much, I don't think that's normal. Now, again, she did note that she had a lot of friends and family members. She spoke to a lot of women who said this was common, right? So now she goes to the professional who also says, hey, this is common. So again, this is where the confirmation bias becomes an issue, right? Because now she's went to the professional, and the professional is apparently telling her this is normal and common. Again, very difficult for me to believe that, but it's very difficult for me to be like, that never happened, because I know this healthcare system that I work in, that I'm a part of. I didn't think much of it. However, I was passing clots the size of a placenta, which was very alarming. They kept me overnight and released me the next day. Fast forward to July 22nd, I was hospitalized again for the same thing. Again, the medical professional treated it like it was not that alarming since it was just a fibroid. So again, this is where she's getting this aspect of it being a fibroid. So then when we go back to this slide here, the fact that bleeding stopped, December of that same year, the bleeding came back again. So this is where you can kind of see where they eventually say, hey, you know what? We're going to do a biopsy of this fibroid because it shouldn't be bleeding the way it is bleeding here. As I went in for this appointment, this doctor asked me if he could look down there. And again, when we say look down there, we're going to talk about it when we talk about vaginal bleeding and just differential diagnosis. Healthcare providers, please, if you don't get nothing from this video right here, I don't care if you're an internist, I don't care if you're a family physician, if you're OB, you're going to do it anyway because that's what OBs do, right? If someone is saying, I'm having vaginal bleeding, you better go look. You best go look. There's no, I'm not looking. Or you send them to someone who's going to look. Like, there is no, I'm not looking. That doesn't make any sense to me whatsoever. Again, I'm a hands-on type of guy. It just boggles my mind that it took this appointment for someone to say, I'm gonna go look. I'm gonna go look down there. And this is what she wrote. She was the first person to show some concern. And this is what typically happens. You go to your friends, your family members. You may go to one doc who doesn't really listen to you, not really culturally competent. They kind of brush you off, say, oh, you're just tired. You're just this, you're just that. And then you find the one person who says, you know what? I'm gonna go the extra mile, which shouldn't be an extra mile, but I'm gonna go the extra mile. She was the first to show some concern. Told her it was okay to check. It didn't take long before she looked at me and said she could not see my cervix because it was blocked by a huge mass. Again, vaginal bleeding, I'm thinking cancer until proven otherwise. Now, can you have an intrauterine fibroid? Yes, it's possible you can have an intrauterine fibroid, but boy, you tell me you having vaginal bleeding, you're weak, you're fatigued, you get to the point where you're like, I'm going to check to make sure that cancer is not afoot. It just is what it is, right? On February 8th, 2023, he performed an outpatient biopsy. When I woke up from anesthesia, he casually said, yep, you have stage 3 cancer. Like I said, I just don't know any physicians who would just casually say, yep, you have stage 3 cancer. It is tissue diagnosis. But I do feel like, yeah, someone likely told you, yes, you have stage 3 cancer. Like, I do think that. But I think that is more like, I don't know. But again, because I can't 100% say it'll never happen, you have to believe your patients. It turns out it was not a fibroid, but cancer. I was misdiagnosed all this time. I remember hearing that and immediately saying to myself, I refuse to make an agreement with that diagnosis. And so I didn't. Being told I have cancer didn't devastate me. It was a reaction that closed to me. I knew that God is my healer and that no weapon formed against me, not even cancer, would prosper. I knew that I am more than a conqueror and I would get through this. So what happened is that she ended up not pursuing any treatment for her cancer, and that unfortunately ultimately passed away. This unfortunately is not an uncommon story. She's a very popular YouTuber, has a lot of notoriety. So when this happens to her, we hear about it. But this isn't an uncommon story where a person who's having a diagnosis like abnormal bleeding and has a delay in care, whether it be due to confirmation bias, whether it be due to lack of access, whether it be due to when you have the access, the person who's supposed to be taking care of you is saying, no, it's something else. This isn't out of the ordinary, ladies and gentlemen. This unfortunately happened to this beautiful young woman here. This isn't a story that I want you to be like, oh, that can't happen to me. Because again, as a physician, healthcare provider, someone who's on this side, I can tell you it 100% definitely can. And that's why it's so important. And that's why I kind of talked about like, all right, is this delay in care? Is this a misdiagnosis? What is this, right? I think it's a combination. I think there are certain decisions either way that could have been made that could have been different, that could have likely had a different outcome and result. But we have to deal with the result that's in front of of us. We have to deal with the fact that someone passed away from cervical cancer. We have to deal with the fact that this person was having profuse vaginal bleeding, profuse pain, required multiple amounts of blood transfusions because she was so anemic. We have to deal with that fact. And then we have to say, all right, what did we learn from this? And I think this is where we get into our nitty gritty. Like, how can we learn to make sure that our story isn't like Mrs. Pettway's story? So let's talk about vaginal bleeding for just a little bit. Again, we'll kind of touch on it. And what I'll be doing, I'm actually going to have one of my good OB-GYN friends come in to talk to us a little bit more on a later show. But as an internist, you got to talk about it. You can't run from it because vaginal bleeding is coming to you one way or the other, as much as you may try to avoid women's health. So when we talk about vaginal bleeding, the first thing, and one thing my attendant used to always tell me, understand the why. And the why always starts in the history taking. Because I can tell you, there's plenty of lab and imaging tests that we'll get into. But if you get a great history, the story tells itself. So as a person, as an internist who I hear that story of vaginal bleeding, one thing I want to know is, all right, like, why do you think this is abnormal? So you have to get a type of history of your patient saying, hey, what is a typical menstrual cycle, bleeding cycle for you? What is normal for you? And why do you think this is abnormal? Because when we talk about abnormal uterine bleeding, abnormal vaginal bleeding, it's always on the basis of, hey, you have a subset that is your norm for you, and this is abnormal. And more importantly, trying to figure out, like, who is it happening to? Is this a teenager? Is this a young adult? Is this a premenopausal, menopausal, postmenopausal? These are certain questions that you need to ask yourself, because if you ask yourself and you start putting patients in certain categories, the diagnosis doesn't like hit you across the face, but it becomes a lot more apparent to say, hey, I need to rule out this versus that. I can tell you from a person, when you hear postmenopausal patient dealing with vaginal bleeding, it's cancer until proven otherwise. It is cancer until proven otherwise. Because if they're postmenopausal, they shouldn't be bleeding. So if they're randomly bleeding, you better make sure it's not cancer. But if it's a menopausal person who's in menopause, young adult, can still bear kids, still has their normal menstrual cycles, but for some reason this is different. When we talk about Jessica, she talked about how hers was different. Hers was more. Hers had more intense pain. These are things that I want you to listen to, especially for the women who are watching this, or even the guys. Send this to the women and say, hey, I want to make sure this is normal. Whatever is normal for me needs to continue to be normal, because once it's not normal, you need to do something about it. History taking is so important because I need to know, is there medication changes? Obviously, there are hormonal medications that can cause you to bleed, right? Birth control and everything. There are certain medications that may cause you to have excess bleeding, right? We got to know. So I need to know your medications. I need to know your history. Obviously, I'm going to know your age. I'm going to know whether you're premenopausal. Like, I'm going to know all of these things here, but I need to know this because I need to put you in certain buckets so I can kind of figure out, all right, where are you lying in at? And again, like I said, we're going to put our internist hat on, because again, the internists, they like women's health, but they don't love women's health, right? But they know that there's a person that I need to take care of, and I need to be this person's advocate. So as a patient, you need to be able to say, hey, you know what? Whatever I thought was normal, I don't care how many people said it was normal. I don't care how many friends and family members told me this was normal. I think this is abnormal. I'm going to a doctor to tell me why this isn't normal, right? And if they say it's normal, but I still think it's abnormal, I may go to a second one. I might get a second opinion and say, hey, you know what? So-and-so said this was normal, but I don't know. This is not normal for me. There's a list of common causes of abnormal uterine bleeding, just so you can kind of read the list, right? But again, it's one of those things where we're ruling out medications. Obviously, you see fibroids will be on there as well too, right? There's going to be certain things that can cause you to bleed, but there are things we're going to want to rule out. When I think about Jessica's story, and I think about the fact that, man, here you have a person screaming signs and symptoms that something was obviously more wrong than just fibroids. Because fibroids is a diagnostic test, right? Like, I do an ultrasound, boom, you have fibroids. It's usually a diagnostic test. But you best believe, if you have any type of bleeding, right, as an OB-GYN, as a family physician, someone who does pap smears, I never did pap smear outside of residency. I had to do it in a residency. As a person who does that, you need to make sure, is this person getting their regular checkups? Because that was a question I had when I was reading Jessica's story. Like, all right, was she getting her regular checkups? Because if she's getting her regular pap smears, I feel like they catch it at stage 1. Now, again, you can have aggressive forms of cervical cancer. But again, that's typically in a person who is not getting routine screenings. So was there a reason why she wasn't getting routine screenings? Was it because she was told that this is normal and I don't need to? Like, what happened? Again, you tend to have more questions than answers, but at the end of the day, a loss of a life is a loss of life. Like, yes, I have these signs, right? And Jessica had them, right? I'm weak, I'm tired, I'm fatigued. This bleeding is heavier than it normally is, right? This bleeding is lasting longer than it normally is. This bleeding is associated with much more pain than it normally is. Like, I'm having ill effects afterwards, right? Where now, again, I can't exercise as much as I can. I'm tired. Like, especially if you're so anemic where you start craving dirt and sand and stuff like that because like I'm so iron deficient, right? There are certain signs and symptoms that we start thinking about like, oh, I need to find out. Because yes, you're having these signs and symptoms that says you're anemic, but you're anemic because you're vaginal bleeding. But I still need to figure out why you're having all of this vaginal bleeding, right? So again, it's one of those things where yes, we don't want to treat the end result, aka like when she was in the hospital and they gave her that blood and they said, oh, we can't do nothing about your fibroid. You're treating the end result, but you're not treating why she's having it in the first place. You got to figure out why she's having it in the first place. And as a patient, as a healthcare provider, we got to figure out like the why. The why is the most important question in medicine. If you understand the why, medicine is so easy. I can assure you, medicine is very easy once you understand the why. People who have difficulty in medicine typically don't understand the why. I talk to residents, nurse practitioners, PAs, medical students. When you don't understand the why, everything looks difficult. Everything looks like it's a difficult, complex case. But once you understand the why, the puzzle just fit and it just makes sense to you. So we have these signs that Jessica had. Again, if you're experiencing, follow up your healthcare provider. And then from a diagnostic thing, what do we typically do? Again, first thing, you're ruling out cancer, right? You're getting a pap smear. You're going to make sure that, hey, this vaginal bleeding isn't due to any abnormal tissue developing, which cancer is. You're going to make sure that that's not the cause of it. And then once you rule all these things out, whether you're doing blood work to see, is this person anemic? Is this person having abnormal hormone levels? You're following up on their medications and saying, all right, is there a medication that might be playing a factor into this bleeding? Once you're doing all of these things here, then you say, all right, maybe fibroids. Okay, cool. I know what I have to do with fibroids. Either I have to deal with the pain, because what happened, and especially for those maybe thinking, like, why do fibroids cause so much pain? What typically happens when you're menstruating, the fibroids can also cause profuse bleeding from your menstrual cycle as well. So that's why people who have fibroids tend to have heavier periods, because you have more excess bleeding from the fibroid fibrous tissue itself. But like I said, we're going to have an expert come on here and really get into the degree, because again, I'm going to have my OB guy. Shout out to my OB guys, right? Because I think it's so important. So I think when you have this aspect of diagnosis and you're doing all your imaging tests, you're doing all your labs, again, everything starts with the history. I can assure you, there's no way Jessica could have told me I'm having profuse bleeding that's causing severe anemia, fatigue, and I'm not sending her to an OB-GYN specifically to get a pap smear to rule out cancer. There's no way that's happening. But I understand that in this healthcare system, we don't listen to our patients. I understand in this healthcare system, we typically don't listen to our Black patients. We typically downplay their pain. We typically downplay their cries, their emotions. We typically would downplay it. I understand that. That's why I'm in the system, to make sure that less people will do that. Whether you're my colleague, making sure that you take care of people who look like me and my mom, my sister, my daughter, my wife, or my son, like making sure that you are going the extra mile like you should, making sure that your implicit bias doesn't seep into your medical decision, where you don't treat Jessica Pettway the same way you may treat someone else of a different race. Make sure that don't happen. That's my healthcare provider, but also making sure that Jessica Pettways of the world recognize, hey, these signs and symptoms, and I don't care if one person told me it's normal, two person told me it's normal, a doctor told me it's normal, a PA, I don't care who told me it's normal. I think it's abnormal, and someone's going to have to get to the bottom of it. Empower yourself for better health. I'm going to advocate for myself until I get to the bottom of it. And unfortunately, we talked about it, that a delay in care and a delay in diagnosis can have deadly consequences. And Jessica Pettway isn't the first, won't be the last. But if you're listening to this, you're watching this, I want to make sure you're not the next. So again, I'm yours truly, Dr. Barry. I hope this conversation on vaginal bleeding, delay in care, delay in diagnosis, and also just kind of this aspect of disparities in healthcare, I hope it's eye-opening to you. This is your first time watching this. You already know I talk about this all out. But if you're your first time watching this, you'll understand that I am a champion of advocating for yourselves, and as a patient, making sure you are in the best position that you can be in. Because if you don't, it could be a life or death decision.